meet those standards. And all that is here is actually based on what's on the ISCP on the ISCP website. So the presentations that we made here, we pretty much cut, copied, pasted, and edited, modified the ISCP words, just so that there's nothing that is there which is misleading, or we've tried our best. I mean, I think the first slide here says disclaimer. It's just to say that, look, all of this is done, out of the best interest in mind for everybody here to share our journey to support each other. So if we've done our best to kind of keep it as useful and as accurate as possible. If there's any shortcoming, please do. We're not GMC, we're not the Royal College, so we're probably 95% there. 5% you just have to give it that human error consideration. Right. So that's the disclaimer, right, Mo?
Yeah.
Okay.
Yeah, that's exactly what I wanted to say in the beginning.
Yeah. So
just
feel free to stop us.
Yeah.
Sorry, Mo?
Yeah, carry on. Just that I'm just echoing what you said. Is basically we are doing this. I'm not claiming that I'm an expert in this and or anything. I'm just using like whatever experience I got from my application or from other people. I have been involved with their application. So by all means, you need to check everything yourself and make sure that you do your homework as well. We're just trying to make these sessions just to make things a bit easier for people who are starting, just so it doesn't feel like a huge mountain to climb with every step. So I think we did like sort of informal session about logbook. It wasn't really well prepared, I think, but I think it was useful for people who attended. I shared it on the group, so hopefully this would be useful for some others as well. Today you asked me to do like this CBD together, so I made this simple presentation using what you sent me. I just modified it a bit. So,
are you recording or is somebody else recording?
Yeah. I think someone is being recorded in the group, so it's okay. It doesn't matter who can. Yeah.
Okay, so that's fine. Cool.
Yeah. So then later I will share it too, as I did with the previous one.
All right.
Okay. So basically, just simply, I'm sure all of you know that, or most of you. So it's basically what is CBD? CBD is like discussion between your trainer and yourself. They usually say that it should take like 15-20 minutes discussion and 5 minutes for feedback. It should involve a case you managed. Okay. Recommendation by the GMC. Which most of this presentation is based like from the GMC website. So basically they recommend using challenging case, and even better if you can discuss a number of cases and try to link them together of the same condition, obviously, then try to merge the learning conditions together. It can be simulated. So if you work in a place where, for example, you don't have access to like vascular surgery, like I did some of the vascular CBDs as simulated. And basically you just need to make sure that the topic is relevant and you do good reflection and to involve all the points that would make it like acceptable by the assessor. And actually it's at the end of each CBD, it will ask you whether it's a simulated or actual condition. So it's perfectly okay to use a simulated case. Okay. Obviously, all of them you must get level 4 for all of the ones we will discuss later. Okay. So what are the points to include? So because sometimes we struggle, okay, what should I include? So generally, so if you go by the ISCP website or even the paper one, so basically it will ask you about, there is a section about about the case. I will show later like an example what I used to do, just as a guide. So some people might do it in a better way. But basically, you would include in one box, it will ask you about information about the case. So I used to put like age, and obviously you have no patient identifier at all in all of them. And you say what was the condition, why was it interesting, why was it challenging, why specifically you choose this case, and then like a summary, basically investigations, finding, and the whole idea is basically to show that what your decision making process and higher level thinking as a consultant, sort of. So it's not like don't write 2 lines and just simple case. Everyone, they would like, even like if you see all the WPAs, they are have a self rating at the end which says, is it a suitable case for, no, this is a like rating for the case itself. Is it suitable for certification, or is it mid-year training or early years of training? So by all means, you should be having like a complex case, challenging one, and show your involvement and higher level thinking, and how you manage the whole case as a consultant, and including referrals you made to other people, so other people involved. It shows that you are a multidisciplinary team player, and you're just not focused on your part of the case. It's also nice to include like what were the concerns of the patient, how did you handle that, what information did you give to them, and the follow-up. Okay. And idea, if even like, it's perfectly okay for all the WBAs to say there is room for development, and you should include a few things like here and there, including what would you do differently, and what did you learn from this case. It's totally acceptable. It doesn't like take away from the fact it's a level 4, and it won't like make it not valid for CESR. So all of us, even as consultants, we have like room for improvement. So that's perfectly okay. So when to do it? So ideally, I think it should. So CBD is, I think, is an easier part compared to PBA. So PBA, you must have like a case that you managed, ideally. But for CBD is basically, even like you don't have to do it at the on the spot, but you can have the discussion with the consultant even anytime, any between cases in theater. So you should really be able to do that. That the whole CBDs should be doable like in a few weeks time, if you are starting from scratch. However, obviously you shouldn't be doing that. I'm just saying that it should be done, like make use of every opportunity you have. So if you manage the case on call and outpatient in A&E, so like make sure that if any nice case that you have seen, or a group of cases of the similar condition, just make sure you do one quickly. And as any WBAs, it should be signed within 4 weeks. I think the 4 weeks is more or less. I don't, as far as I remember it, it's not like mentioned as like a strict number, but be strict duration. But ideally you should have it recent, so to avoid any like risk of like them saying it, you have done this and signed it after 6 months or so. But ideally it should be as soon as possible. um, what are the topics required? So there is a list of topics. This is one of the things that have been for a long time in the guidance. One of the things that didn't change much. So for each of these topics, you should have one level 4 CBD in each one of them. Okay, at least. Um, you don't have to include like 4 or 5. They will reject it. So it doesn't have to be like but you should make sure that you cover every one of them, and in your index you should make sure exactly what like CBD you are submitting it against. What I mean is basically, for example, if you say you submit it, so acute abdomen, if you notice, acute abdomen is one of the things. So it can, so someone who has intestinal ischemia can present with acute abdomen. So if you include a case, for example, for bowel ischemia as your example for assessment of acute abdomen, you should make this very clear in the index. Okay. Otherwise, they will say that you submitted 2 cases under intestinal ischemia, but none under acute abdomen. So this was an example for one of the colleagues who one of the comments they got. So basically, these are mandatory topics. As I said, each one of them has to have one at least level 4 CBD, and ideally try to make it robust, include differential diagnosis, include different cases. You can expand the discussion to include other similar scenarios. So, for example, if it's a strangulated inguinal hernia, you can include this to expand it to bowel obstruction in general or other strangulated femoral hernia, or you can expand it, just show that it's a discussion and between two consultants, not just ST3 doing their case. Um, so these are the examples. You can find this in the guidance easily. Also, these come under the mandatory topics and under general surgery. So whatever your subspecialty, so if you're submitting colorectal, you still need to submit the upper GI and vascular, and otherwise, and vice versa. So you should include one for each of these level 4 CBD. Again, for vascular, ruptured AAA, acute limb ischemia. This is one of the topics for me. It was, although I did a year of vascular, but this was outside the 6 years for the evidence. So basically, I had to do some of them. I had to do as simulated. Actually, I did yeah, one of them with renal, so he probably doesn't remember. But yeah, so basically, you need to include like level 4 CBD for each of all these mandatory topics. In addition to that, so depending on your subspecialty, so if you're applying, you need 10 CBDs um, on all the important topics in your subspecialty. So there is no specific list. So basically, what I did is, as last line here, for me, what I did, I had a look at the textbooks index companion, and I should had a look at all the topics, and then just made a list of that and tried to, as I go, whenever I see a case like that, then I take that and include it this way. So you can do that or whatever. So as long as you include 10 different topics in your special interest, colorectal or upper GI, this should be okay. And be careful if you are submitting one. So as later I will show how I uploaded mine. So I separated the critical conditions from the special interest. But sometimes if you are doing this one similar topic so let's say you are HBB and you're submitting acute pancreatitis, which comes also under general surgery, just make sure that which case you are submitting. Make it very clear that you ticked every box. Again, all of them should be level 4. Uh, so how to upload them? You can use ISB website. I think it's better. It's easier. It makes everything looks like what the trainees do, and I don't know. I feel like, but it's not mandatory. So I feel it's better, but it's not mandatory. You can perfectly. I know people who used printed forms and it was accepted. It's completely fine. What you can do in ICB, if you don't want to pay the whole year, you can. What I did sometimes in one of the years, I basically asked them to pay subscription for 1 month or 2 months. So they are fine by that. Even like I remember last week before my application, I told them that I just need to add one more case, and they opened it up for me for 1 week for free. So you don't have to pay the whole thing if you think it's too much, but I think it's better, it's easier to make your life easier. So and then you will download them as PDF. I will later show how to do that if anyone wants, and then keep storing them in a folder, okay, until you feel that you are ready to submit. Then group them by hospital. So again, I will show how to do that, and you then use split general surgery from critical condition. And as for me, as a general rule, in any evidence you submit all across CESR or portfolio pathway, do an index, okay? Just make the life of the assessor easier, okay? You are helping yourself by making their life easier. If you make it all haphazard, then they are likely to miss some stuff you submitted. So do an index for everything. So that's what I did for my own application. Um, This is how the paper form looks like, and it's similar to basically what you had. So what you have in ISCB. So basically, this is a feedback of the consultant. This is your feedback. You should assess yourself. And it says optional, but I think this is mandatory. You should show that you have insight. What did you do well? What would you change? So all of this scores well. Um, Again, clinical setting. So if you say here it's like there's simulated, so it's acceptable to have simulated. Reflective, I don't have much experience with reflective CBDs, so maybe someone else from can jump in and explain. So here you say critical condition as well. And I think if I remember correctly, in the website itself, it allows you to choose which critical condition you are submitting against. Um, just make sure that you do it and sign it as soon as possible. Um, so that's simply like a quick presentation. Happy to take questions now, and then I will start showing example of what I did and like how to download it from the ISCB website. Yeah, so yeah,
So,
Renold, do you want to?
there's one thing I want to say that your CBD is basically meant to kind of you please get used to this word called higher order thinking. It's basically to show that you can function as a consultant, which most of you are already. You just got to demonstrate it. And that's meant to kind of get three important factors into your uh, assessment. Your clinical judgment, where you compile all your um, evidences and clinical data. Your decision making, where you actually learn to prioritize. And third, the application of medical knowledge. Now, so all that you do should be able to reflect all of this that they want to look at. So, like as though so you should be like Mo mentioned, this should be like as though it's a discussion between two colleagues rather than it being a top to bottom kind of discussion. It has to be a horizontal discussion between two equals, and that is where you've got to kind of raise your level up to. That's one thing you want to be mindful about. And hence, what those elements are, if you look at the ICP website, it actually has details as to what you should not, how you should, where, why. It's got a lot more detail than that's on the slide. So please must read the ICP instructions on how to do a good CBD. And please don't think twice about spending money on your ICP portfolio. This whole process is your own self-funded, self-whatever. It's just worth the money that you put in because you just want it to be as perfect as possible. Thank you.
Sharif?
Good morning, Dr. Ablatif. I hope you are okay. Thank you for all this presentation. It means a lot, especially for one of like me who just started to have a special interest in colorectal about months ago. So I'm just starting to build my CBDs, especially usually I waste my time during the on calls not to do it. So I'm especially I have my SB account to be honest, but I usually do the procedures based assessment. I never did any CBD before because sometimes I found I'm not aware about how to fill it or what I could fill it. Um, this is my first time actually to know from you, and I hope for next lecture to get inside about what the CESR pathway could be, what I need to do, how I start to look for that, what I need to just collect by year or by following years, what I need to collect, how many times I need, how I develop it. I'm just know today that how I could fill my CBD, so I will start to work on that from my next week. And so I will try to do it as you told Mr. Ablatif as soon as you could do it. I have some I discussed with my consultant. He is very supportive, so he could sign off for me, but I don't think he will sign it as level 4. So is my question is to do the CBD while I'm concerned that I will be signed off as level 4 or just do any CBD, whatever the type of or level of confidence will be signed.
Well, you will never know until they sign it, so you don't know what level they will give you. For Caesar, it won't count if you have. It won't matter if you have level 3 or level 2. It doesn't. They will not look into your. They will look into what you submitted, and they only count level 4. So So but I think it's good practice to keep doing them.
Okay.
So Sharif, you're just about starting the journey, isn't it?
Yeah.
So yeah. So I mean, how you're quite new into the system. You're just starting. It'll take you a while before you hit your level 4s. But the point is, your level 4 must be within the last 2 years of your submission.
Okay.
And definitely by the time you hit level 4, you'll be there, almost there in time. So basically, looking at about 3, 4, 5 years. Basically, that's about the time the training takes, anyways. Okay.
Okay. Okay.
Yeah. So basically, start practicing. That's what it is.
That's okay. Okay. Thank you.
Who's next? Sandeep. Sorry, we
You're
cannot
muted,
hear
Sandeep.
you.
You're muted.
Can you hear me?
Yeah.
So basically, it's like about just a feedback, I think. Yeah. Sorry. So what has happened is I've been doing PBS, but CBDs I really didn't try that hard. But when I went into doing the CBDs, I realized there is one column called a reflective journal entry. Does this correspond to a reflective journal entry? So I got a bit worried because I don't really understand what that means. This is for the PBS as well. There is a question that asks, does this entry correspond to a reflective journal entry? So do we have to do a
So
separate one?
so if you've done a reflection with it, then you say yes. If you
Okay.
haven't done a company reflection with it, then say no. That's it.
You don't have to separately keep another. There is no other place that you
No,
keep.
if you've done it, then please make sure you mention it and you
Yeah.
index it. That's all.
Fine.
You don't
All
have
right.
to.
That's fine.
If you've
Yeah.
done it, make
Yeah.
sure you do. And as much as possible, there will be certain procedures where you need that kind of reflective linking, but not all of them.
All right.
Yeah.
So that was
For
something.
for me, I have done all. No, I didn't do any reflective ones. But that's me. So
And the triple A's and the vascular things, you can do like a discussion with the consultant, and then
That's it.
so,
Easy.
does it need to be a vascular consultant then?
no.
All right. Okay. Thank you.
Number. So is
Jamil?
Jamil.
Hi all. This is my first time I'm in the meeting. I've joined the group for quite I think a few weeks back, but didn't get time to get in touch. So it's my first time. Basically, I'm working in Bolton, Manchester. I've done my exam. I've done my endoscopies about a year ago, but I'm lacking on these things like the CBDs, PBS, and all that stuff and audits. So now I'm starting these, so that's why I joined the group. I've not done anything yet, so it's very beginner. And thank you very much, Mo, for helping us and the whole team. So I'm hoping I'll start from next week.
So if you've done your exam, I think you've done the most important thing to start, because no exam, no CESR portfolio, whatever. So now that you've done it, I think give yourself the next 1 or 2 years to get everything done. So I think just focus on, just start doing your CBDs. It's not a big deal. If you've done your exam, they will look at you differently. Once you've done your exam, you get a different level of acknowledgement, respect, engagement. So please use it to your advantage. Learn how to do CBDs. If you don't know how to do CBD, don't worry. Read the guidance on the ICP website. Talk to trainees who are around, or you talk to anybody else. Just make friends with whoever. Just you can call one of us. Call anybody, and just start doing it. Just if you don't do it, you'll never learn it. So don't worry about it. These are all things that we all have gone through. So please just get on and do it, because the sooner you do it, the better for you.
Yes, that's my target. I've been Jack accredited about a year ago, both for upper and lower GI. My specialty is colorectal, though. But now the next 2 years, I gave like
So
myself this
you've
next 2
done
years.
a lot of hard work already. You've done the most important bits. Now, these things are quite, they're quite easy to do. You just have to get doing it. That's all.
They're a bit tricky because we're not used to it to do it,
I know you're
But
not
once
used
I
to
think
talking,
once
you're
we
not used to
start,
writing.
exactly, yeah.
Don't worry, you'll do it. No problem. Just
Thank
start.
you.
That's all.
Yeah. Thank you.
Yeah, I would
Thank
say I would agree with Renol. You have done the most difficult part. For me, I think anyone who passed the FRCS exam, they should
Yeah.
put a target maximum 1 year to submit the application,
you.
their first application, and it's perfectly doable. You don't have, even if you have lacking the endoscopy numbers, or so 1 year from your FRCS pass, you should be submitting first application, because people, there is a misconception that thinking that the application, the day of submission of the application, everything ready. This is absolutely wrong. So I submitted my first application in August 2023. I in I can tell you, like, in March 2024, still I was submitting evidence. Okay. Um, so that's absolutely fine. So you can still upload evidence for 6 months after your initial submission date. And also, even another thing I realized from my own experience, I think people who want to finish to do it quicker, they should look at Caesar as sorry, there's some feedback. They should look at do it in two, like, I think for me, I would advise people to accept that CESR is a two-stage process, to accept that most of us will get a review application. Some people are very good. But for me, I delayed my application by 1 year because of just exactly the two mistakes that I just mentioned. So one of them, after FRCS, I thought there is a lot of stuff missing. But I think looking back, I should have submitted my first application 1 year after I passed. Second is basically I delayed my application, initial one, to make sure that I have everything. I have a perfect application, and I did everything, and then still they caught me on very silly stuff. And basically, one of them is like, I shared this in the group before, so I won't repeat myself, but they can catch you. So I think for me, 90% people will have a review application. So the quicker you submit your initial one, is better. Even if you are not ready, even if you are lacking endoscopy numbers, just do it. 1 year from your FRCS, that's maximum. You shouldn't delay it any longer. I think one other thing to make it easy for you when you fill the CBDs. So I know some people, like, they try to fill in the on behalf of the consultant. Sometimes I'm not sure if this is right or wrong, but anyway, the consultant will look into it himself as well when they do. But just I'm sure if you talk to any of the consultants, basically they will say that they have lots on their plate and don't have much time to do. Some of them are really good to do it quickly, but if you want to make life easier, what you can do is can print a paper form and allow them to write it, like handwrite it, and then you transfer their entry into the website. This way you make it a bit easier for them and make it more difficult for them to say I don't have time, or I will do it next week, or so. That's my two bits of advice for you. Next one is Rajendran.
Hello, hi. Hello, good evening. I'm first time with the CESR actually. So I completed all the exams and everything like long time ago. But I didn't do my CESR actually. So I'm planning to stay here. So I just started my CESR application. I'm in the NHS for more than 7 years at the moment. I'm not going to be 8 years now. Is it possible to do retrospectively the PBAs? Is it okay? How to do that? Is difficult?
It's not ideal. The GMC doesn't want you to do that. So if you try to do it, it's going to be almost illegal. So if you get into trouble, it's not worth it. So what is gone is gone. You just have to get them all prospectively done. You could try all sorts of backhand stuff, like, for example, take printed out paper, tell your consultant to fill, backdate it, and stuff like that. But if at all by any chance you're caught out, and there is no excuse for you, you're better off not doing it. So it's not worth the risk. No.
I'm applying an HPB and transplant. I'm currently only doing HPB. My transplant was done 3 years ago. Like, in that case, the only way to do is getting because the procedure was done in 3 years ago. The transplant one, HPB I can get currently, But transplant numbers, we want to get it. How to do
So
that?
if you look at the guidance, it says they want your CBDs and work-based assessments to be in the last 2 years.
Okay.
So that is where you will struggle a bit, but you've got to find a way to sort it out.
Okay.
Yeah. I'm just conscious of the time, and I want to focus on the specific topic. So I appreciate people are coming from all different stages. So let's focus this today on CBDs only, questions related to CBD. And then you are more than welcome to ask questions on the group. There are so many helpful people to ask to answer the questions, but just to keep it short session so that we can share.
Yeah.
So so CBD's questions, please. Okay.
Yeah. Adil.
Iqbal.
Okay. Yeah.
Oh, okay. Adil, sorry.
Hi, Mo. Hi, Reno. Thanks for these sessions. They're really helpful. I appreciate the support. I've got a few questions. The first question is, in terms of vascular procedures or vascular CBDs, how do we have to do all the three you've highlighted, the aneurysm, the AAA, and the compartment, and the acute limb ischemia?
Yeah.
Do we have to do all the three?
Mandatory. All the three, yes. Yeah. All mandatory.
Okay. Perfect. The second question is about the AI supported filling of the CBD. Any experience, any feedback?
I don't think there is any strict guidance from the GMC about that, but I'm sure using AI to refine your language or do a bit like make it look better, I think that should be okay. I don't know, but basically using AI to like fabricate stuff, that's not acceptable. So as long as you are using it to improve your language, I don't think that's a problem. We will use AI to improve our
I've heard them
emails
talk a lot about AI input into these things. So please refrain from, like Mo said, refrain from using it as a means to do your WBAs. They can be there to support you, to help you to format and structure. That is for you to learn from. That's all. Because they have tools of identifying AI-based stuff. So please don't get into that trouble. Don't bother with that AI generated thing onto your PBAs, please, for heaven's sake, onto your work-based assessments. Yeah.
Thanks.
Iqbal.
Thanks, Mohammed and Renol, for the presentation. I just joined in the middle, so I might have missed. What's the time allowed, like when you fill in the CBD, and then it is signed off by the consultant and for PBAs as well? What's the maximum time allowed? Has to be done in the same day or date or?
Oh, no. So there is no, I don't think they said a specific date, but ideally it should be as soon as possible. I would avoid more than 4 weeks. I know people who got away with longer, but as Renol said, just they are easily to be done. So just especially CBDs. So try to do them like maximum 4 weeks. Ideally, as soon as possible. 1 week should be okay. And the way
This
to
is
do
actually
to
trying
make
to reduce the 4 weeks to 2 weeks. So as much as possible, try to get everything done within 2 weeks. 4
Yeah.
weeks is like the max possible ever. Okay.
and try to help yourself by helping the consultant. So if you get a paper form, give it to them. Just use a suitable time. Because it's not easy, but that's the difficulty in CBDs and WBs in general, getting the consultants to sign the form. But just make sure in the department they know that you are going through CESR and you need the support, and I'm sure most people will be willing to help.
Yeah.
Thanks.
Fahad?
Yeah, thank you, Muhammad and Reynolds, for this valuable presentation. My question is, you said we need to group the CBDs according to the hospital. A candidates like me who's jumping from multiple hospital in the last 4 years, is that needed to group the by hospital and by required CBDs? As you mentioned, we need 10 and 10. So if I did like, for example, three in that hospital and which is required in the my subspecialty and three in the other hospital in the other, 10 groups. Should I group them together?
Yeah.
This is the first
Because
question. Second question.
you need to verify it at the end, so it needs to be
What kind
separated
of
by history.
verification? Sorry, Mo. What kind of verification?
You will include them in the verification performa, and at the end,
Is it the
and you will
as
have separate one.
as my understanding, the verification performa should be for e-logbook only, or all WBA and CBD also. Okay, thank you. Thank you.
No, every
That's one
evidence needs to be
question.
verified apart from a few things. So
Thank you. And the other thing, is it necessarily to be signed off by a consultant?
I
I mean,
think
they say maybe
don't
may
go
not
there.
be. Yeah.
Yeah.
As
Yeah,
much as you
don't go there,
can,
just
do it. As much as you can.
Yeah. Thank you very much. Thank you for your help, guys.
No problem.
ideally by consultant who is in the GMC as a consultant, like CESR or CCT or whatever. So, but they say it can be someone like more senior, but I really didn't try it, and it's better to have a consultant. Ihab?
Yes, hi, thank you, Mohammed and Renaud for this presentation. I just want to ask if you can give like a specific example on how to write a CBD, let's say for a case of diverticular perforation, for example. Usually what in my mind, or what I'm thinking to write, I've seen this patient, I've assisted him, started sepsis 6, get a CT scan done, examined him, then localized perforation. I decided to manage conservatively, discuss with the consultant, agreed with the plan, antibiotics, all these things. Is this how it should be written, or is there anything else? So if you can give like a specific example about.
Shall I just share my screen for a minute?
Yeah.
Okay. Can you see my slide? Can you see my can you see my screen?
Yeah.
So to answer your thing, Ihab, can you see this?
Yes.
The trainee should be able to explain information, what was interesting, what was challenging, the decision-making process, what was considered, assumptions made and reasons for them, investigation ordered, follow-up. So basically, all this is on the ISCP website. So if you just look at the ISCP website and see how to do a CBD, it tells you word by word how you should do a CBD. Okay?
Okay.
So if you can please look it up, we'll put the stuff onto the group, but the point is it's all there. If you please look deep into it, it's there. It just says, see, look at this. It says, what investigation do you order? What were your follow-up? What, and then you link it up with other cases. So every little detail as to how you should do a CBD is there.
Okay.
Okay.
Yeah, thank you.
Okay, thanks, Ed. Thank you.
Any other questions? Doesn't look like. Okay. I'm not sure if it will be helpful for people. I can share like a general idea how I grouped mine. Do you think it will be helpful or to show? Or
yeah.
Not sure.
Sure. I think might as well complete the whole triangulated now.
So okay, let me first see what I wanted to.
I just want you all to understand this concept of triangulation of evidence. So triangulation of evidence, anything and everything you do is triangulation, meaning 3 bits of evidence to prove one particular activity. So if you look at it, all your PBAs and CBDs, they all want them all 3 different people, and that is triangulation. If you add reflection to anything, that just becomes part of your triangulation also. So what I'm trying to say is all your CBDs, because you're doing 3 by 3, you're doing 3 different consultants at level 4. That's 3 different means of triangulating your evidence.
Okay. So can you see my screen?
Yeah, we can.
Okay. This is another guidance from the ISCP, what to include, what to do, and basically So I'll just make it bigger. So this is example. I use part of this. So basically case presentations, patients you have seen in the outpatient, A&E, during calls. They have written a paragraph here about reflective CBD. Can share this in the group later. And basically, this is what they mentioned about what to include. It's what you just mentioned, Reno. So I will share this document later on the group, just to give an idea what you need to include. Okay. So basically, another thing I will show is basically how I grouped my CBDs. So here, this is all my WPAs. What I did is basically I grouped so CBDs colorectal special interest from the first hospital Kettering times 9, and then CBDs colorectal special interest from Leicester, another 3 CBDs, and the critical conditions ones 15 from one hospital and 3 from another. And again, if I go back, for me, I always put index to anything, so just make life easier for the assessor. And so basically, what CBD, and I used the same title, same like titles they used: assessment of acute abdomen, strangulated hernia, intestinal ischemia, obstruction, assessor, date, level 4, and page number. So it's quite easy for them to go through that. Then another thing I added, I probably don't have to, but I just tried to make it even easier, that basically this critical condition 1, this assessment of acute abdomen. Some of my CBD were not very good quality. I think this is one of them, but I'll try to find one which is better. So just yeah, I mean, just try to include like what I have done, what could you do well, what could you improve. I want to show one where I mentioned some room of improvement. There are some which I basically what I needed to improve, gain experience and whatever. So basically, just make sure that it's okay if you feel like you need to add something for improvement, but not all of them, obviously, but some of them can be that way. And some of them can be simulated, some of them can be on paper forms. For example, I think this is a better one. So basically discussed. So this is a consultant feedback, and this is basically what I mentioned. So just a few examples of how to do them. And I think very important, all of them put stuff like for where is it? Yeah, for index everything. So just make life easier for them, and make sure that on total you have covered all the conditions. Okay, you ticked all the boxes basically. Another thing I will try to show is basically let's see how to download them from the ISCP. Haven't used this for some time, so sorry if I'm a bit slow. So basically, here's my ISCP. Sorry, I'll just stop sharing for a second.
Are there any other questions anybody has to ask in the meantime? We will stop in the next 10 minutes.
So basically, how do you download them? So yeah, okay. So that's how it is. Okay. So I'll share again. Okay. And okay, so basically, you go to your ISCP website. You click on portfolio, you click CBD's discussion, and then click portfolio report. this is how to download them. And basically you choose start date, end date, start date. Okay. Obviously this should be within your the period you are using, but I'm just leaving it here because we don't need. You should click yes here, individual assessment details, yes. And then when you come here, I unselect all of that and just leave the CBD. Okay. And then yeah, I think that's all. And then what you can, then you click view report, and then you click here and save it as a PDF.
So all the evidence is in PDF. Whatever evidence, all in PDF. And hence you need a PDF editor to cut the big report that Mo is downloading now to group them all together.
Yeah. And then once you have the PDF editor, so these you can, so basically what I did, I removed all these pages, all of these in the front you don't need. You just need to keep the assessment pages, okay? And then like basically like keep that the CBDs, all of them, and then you start working them by hospital and grouping them and all of what we mentioned earlier, but grouping by condition and by hospital. Okay, I hope it's clear. So any questions, happy to answer.
Yeah. Other?
Yes, thanks. Now, I am in a situation where I work in a health board in South Wales, and there are 4 different hospitals under the health board. So, and I do these PBAs under different, hospitals. Will the basically assessor or organizer understand that these are, do I have to verify the evidence of each hospital by a different person, or will they understand that these CBDs or whatever BBAs are done within a single health board, which has 4 different hospitals, basically?
So when you actually select your trust from your ISCP or wherever, there's a drop down. It should come up as either it comes as one trust or it comes as whatever. So whatever comes, you just put, as long as you group them all together and give them a valid reasoning.
The
that
problem
should be fine.
they come under different hospital. They don't come under the name of the board.
So
So
you just have to group them accordingly and say that they belong to the same board. That's what you want.
do I have to do that in a cover letter, or do I have
Yes,
to put that
correct.
in a job plan? Or
No, you make sure it's in your cover letter and accordingly your index reflects the same. That's all. Cover letter,
okay.
index to show that they all belong to the same.
Yeah. Okay. Thanks.
Okay.
But you should have one verifier for them to make sure that someone is happy to verify all the evidence.
Correct. Yeah.
Yeah. Yeah, the verifier would be working in the same health board, would be able to verify all the 4 hospitals.
That's perfect. That's perfect.
But it's just for the assessor to understand that these 4 hospitals come under single health board.
Don't worry.
You can write it in the index for whatever. Like for example, some of my evidence basically I written like sort of a sentence or 2 to explain like, so something like this. If you have like you're submitting CBDs from different hospitals, just say NB or whatever. Just these hospitals are all part of the same.
Yeah.
Right.
Okay.
Tarek?
Hi, Bot, and thank you for this presentation. Hi, Ronald. Nice to see you.
Hi.
My question is about the triangulation. So you mentioned that CBD from 3 different consultants, but my understanding is for each condition we need 1 CBD. Did you mean the PPAs? PPAs,
PBA.
yes.
PBA. That's right.
Yeah. Okay. Another thing is they accept many cases as well, aren't they? So maybe
Yeah, they accept, but I don't know.
The
I
thing
haven't
is, I
tried to use them.
I think for your level, or rather for our level, CBDs are better than KEXs. So mini KEXs are meant to be for junior level. I think at your level, you need to be doing CBDs and PBS. So just focus on PBS and CBDs really.
What about many cases for consenting? So for example, if I consent for a cancer resection case and they send one.
Yeah, this is an evidence. You can put it under evidence for consent rather than an evidence of a case-based discussion. I don't think it will. I think so. Some of the questions are difficult to answer, but basically, you don't make it difficult. So make it simple and like do the CBDs and PBAs. You can use this mini kicks as evidence for on your consent part of the CESR, but not. I wouldn't use it for WBAs.
Okay.
Okay, Pradeep.
Thank you very much. Thanks.
Mo and also how to take individual CBDs by PDF editor. We can do that. I have a combination, all combinations, so we can edit by PDF editor. Is it correct?
Correct.
Okay.
Yeah.
Thank you.
Yeah. Okay. Hopefully this covered everything. So
I mean,
doesn't look like
if there's
there is
any
any more
doubt, just
questions.
ask in the group, like Mo says. Just ask in the group, and I'm sure we'll all jump in and support each other. So yeah. All right, Mo. Thank you very much. Thank you, everybody, for your time, and all the very best.
Thank you.
Thank
Thank
you.
you.
Good night. Good night.
Thank you.
Thanks,
Thank you.
Mo.